Today on CityCast Boise. Between federal cuts to Planned Parenthood, shrinking Medicaid reimbursements, and Idaho's looming budget shortfall, our state's health system safety net is looking shaky. We're examining how these shifts could reshape our healthcare and what choices people still have. It's Monday, October 6th. I'm Lindsay Van Allen, and this is what Boise's talking about. Joining me to dig into this topic is Kelsey Mosley Morris, a reproductive rights reporter with States Newsroom. Thank you so much for being here today, Kelsey.
Thanks for having me.
Now, a federal appeals court has cleared the way for the Trump administration to implement a provision of the big, beautiful bill that would deprive Planned Parenthood of Medicaid funding. So what will this mean in practical terms for reproductive health care access in the Treasure Valley?
Well, we don't exactly know yet what exactly it will mean because there are lawsuits going on and they're not resolved yet. But we already have seen some changes to care, and we will continue to see more. So they will be moving to a sliding scale instead of low cost or free services for certain types of care at the Meridian Clinic. The overall affiliate that is responsible for that clinic is moving to that.
At the Planned Parenthood clinic?
Yes.
Okay.
So the overall affiliate that includes Western Washington, Alaska, Hawaii, Indiana, and Kentucky is making those changes in response to all of this because Idaho does not have any kind of plan to, backfill those dollars, and unlike places like Hawaii. So it is going to mean already that we have lower access to types of care, and it's possible that there will be restrictions on the types of birth control that you can receive. I haven't heard about that yet, but these are the types of possibilities that we have, and it is possible that the clinic could close if things get too tight.
Yeah, like you mentioned, Idaho's Medicaid program is already facing shortfalls and cost overruns. So how does that financial crunch intersect with these new federal cuts?
There's these separate Planned Parenthood cuts on top of federal Medicaid cuts that are amounting to almost $1 trillion, I believe, over the next 10 years. And so we've got those federal cuts on top of this, on top of the state might cut more in the upcoming session, especially because there's reportedly a deficit that we're looking at. So definitely it doesn't seem like anybody's coming to rescue the Meridian Planned Parenthood. And I think it will just make things even harder for patients of all types.
And just to clarify for listeners, Medicaid can't be used for abortions because of federal law, but Planned Parenthood relies on Medicaid reimbursement for other routine healthcare services to keep their doors open. So how big of a gap will there be for these clinics, especially, the Meridian Clinic, when that funding disappears?
I would clarify that it doesn't pay for most abortions. There are exceptions for rape and incest and some medical situations. But for the most part, yes, federal abortion care cannot be paid for with Medicaid tax dollars. And especially in Idaho, that's not allowed either. I don't know that the dollar amount is terribly big for Idaho's clinic itself. And I don't know that they have a huge population of Medicaid patients. But it's the fact that all of these factors are compounding on top of each other and making it much more difficult for them to operate on top of donation dollars that were already down and political headwinds that they'd already been facing. The Title X funding that they lost earlier this year, I believe that affected the Idaho clinic as well. And that has affected other clinics around the state too. So we're just seeing this kind of slow erosion, not even slow, it's pretty fast actually, of access to care and options for people who really need flexible financial options.
And if we zoom out a little bit, you recently reported that the Ontario-Oregon Planned Parenthood Clinic has seen a massive surge in out-of-state, likely Idaho patients since the Idaho abortion bans went into effect after the Dobbs decision. So what is the likely impact the Medicaid cuts will have on that clinic?
Again, we're not sure. None of these clinics want to say they're going to close, and they are very committed to staying open. But I believe the stat that we had in that story was about 80% of their patients are from out of state at that Ontario clinic. And they're the only clinic in Oregon that provides that much abortion care because of its proximity to Boise and the Boise area. And even still, that clinic only provides it up until 12 weeks of pregnancy. So if you need an abortion after that, you still have to go further. But a lot of people who don't want to take the risk of having pills mailed to them or who just prefer in-person care are going to Ontario for that. And even I've heard anecdotally, like people who need ectopic pregnancy care sometimes get turned away from their doctors because they're afraid to treat them here. And they would just rather they go out of state. So, they're driving an hour to get there. And if we were to lose that, I think it would be a much worse situation for emergency rooms and all these places that are already currently overloaded are just going to see more spillover.
Yeah, I want to dig into that a little bit more because let's say the worst case scenario happens that Ontario clinic has to close or the Meridian clinic has to close. What options would Idahoans in the Treasure Valley have for abortion care, but also reproductive care that's within their budget or financially accessible?
So for now, in terms of abortion care, you can order pills online. There are several websites where you can do that. I don't know what changes in the law might come in the next 6 months or so, because there are threats to that access. But that is currently an option. And if you wanted to go in person, if those clinics were to go away, Bend would probably be your closest option to the west. In Oregon, that's about 5 hours away. And to the south would be Salt Lake City, and that's another about 5-hour drive. So either way, you're looking at a pretty lengthy drive. And if you went north, that would be at least 8 hours to the Spokane clinic, I would think.
And in your reporting and investigation into this issue, Kelsey, how many Idahoans and Eastern Oregonians depend on Medicaid access for reproductive and preventative care right now? Do we have an estimate?
So it's hard to say with the Oregon clinic because of the fact that 80% of their clients come from out of state. What we do know is about 70% of the patients receiving care at Planned Parenthood health centers in Oregon in general are on Medicaid. And the ones in Idaho going to the Meridian clinic are about 15% on Medicaid. So it's a much smaller population. But what matters most in terms of the Meridian clinic is that we don't have a whole lot of access right now to quick care for people looking just for wellness exams or for pap smears to check for cervical cancer or STDs screenings and things like that. And one of the patients that I talked to there was talking about how she could not get into clinics around here in a timely manner. And so the Medicaid aspect is very much important, and it's affecting very vulnerable people who are already at the very bottom of our income scales, because to qualify for Medicaid, you have to be making very small amounts of money. But it's also the fact that this is a service that we really need here because of our lack of access and the lack of care that's available due to the fact that the abortion bans have driven people out of the state.
So it sounds like it's not necessarily, if we specifically look at the Meridian Clinic, it's not necessarily an issue that the majority of their patients are on Medicaid, but that the clinic relies on this Medicaid reimbursement to keep their doors open. And so if they lose that, even if 85% of their patients don't use Medicaid, they're going to lose access to those quick services.
Right. And, even if that clinic isn't relying very much on Medicaid reimbursement, they're part of an overall affiliate and organization that is, and they've got higher populations in those other states that are relying on Medicaid. And, when it comes to consolidating, they do have to make those decisions, and they have in Indiana and places like rural Indiana. They've closed their doors on those clinics because there's not as many people accessing them, and they have to prioritize some of the bigger areas sometimes when funding gets too small. So, a place like Meridian that isn't as reliant on those dollars maybe they'll have a better chance of sticking around, or maybe not. Maybe they'll be the first to go. So it's hard to say what's going to happen, but we know what will happen to care if that does come to pass.
Immerse yourself in luxury at Black Rock Mountain Resort. Nestled just outside Park City, they're perfectly placed just minutes from the slopes and buzz of Main Street, but secluded enough to feel like a true mountain escape. Whether you're planning a getaway for a small or large group, their spacious suites, complete with full kitchens and laundry, give you the privacy of home with the elegance of a world-class resort. You can catch Black Rock Mountain Resort's shuttle to the ski slopes or downtown, then recharge in their sauna, steam room, or year-round outdoor pool. Plus, enjoy fresh, locally inspired cuisine at Overlook Restaurant and bold cocktails at On the Rocks Bar. And this November, they're upping the excitement with a new NHL-sized ice arena and concert venue. Black Rock Mountain Resort is your ticket to luxury, adventure, and entertainment, all in one breathtaking destination. Visit blackrockmountainresort.com and use promo code CityCast for 20% off, a $50 resort credit, and 2 p.m. late checkout. Parents, got one of those random school days off coming up? Instead of another full day of screen time, send your kids to a Summit Innovation Lab day camp where their imaginations can run wild and they can turn downtime into discovery. Children can use Tinkercad to design 3D models, then print their own keychains, inventions, or toys, and learn how to turn their imagination into reality. It's a hands-on, beginner-friendly way that Summit Innovation Lab offers your child the chance to combine their creativity with technology and bring their ideas to life. At Summit Innovation Lab, they make STEM accessible and exciting in an inclusive environment where every child belongs. Give your kids a screen-free day they'll never forget. Learn more at summitinnovationlab.com. Are providers in the Treasure Valley able and ready to absorb those patients if, let's say, the Planned Parenthood clinic scales back care or even has to close?
I don't want to say no, because I don't know that that's a fact. But I do know that they are already extremely strained. And I have spoken to several OBGYNs who are in their own private practice who used to have a lot more resources available and are now like stretching themselves very thin in order to accommodate all the people that they have coming to their clinics. And in a lot of ways, they're making that happen, but the wait times have been longer. The times for surgeries, to get in for surgeries, have been longer. The times to get in for a wellness exam have been very long. And those established clinics have a lot of patients on their rolls, and they end up prioritizing people differently than a place like Planned Parenthood can. So will they be able to absorb it? They might not have a choice, but I think the kind of care that you're going to see will likely be very diminished, and even more so than it is now.
Well, and I think a factor that plays into this, obviously, is the fact that we've lost 35% of our OBGYNs in just a couple of years. And that is a huge factor in why wait times have increased, or it's more difficult to get in for an appointment, or you're definitely not going to get same day or same week care. It's just, we've relied on Planned Parenthood to fill that gap, but now that just might not be available anymore.
Yeah, I kind of likened it to urgent care for reproductive health care, because you really can honestly just walk in and get certain services like STD testing and things along those lines. And you really can't do that anywhere else that quickly, usually. So it will be a tremendous loss if that does happen.
And you briefly touched on this, but you told me that you got a chance to speak with Idahoans who rely on Planned Parenthood and Medicaid for reproductive care services. What kind of an impact did they say these cuts are going to have on them?
So the one woman I spoke with was in her 40s, and she'd had a hysterectomy, I think it was last year, and she hadn't had a wellness exam since then. And she'd been trying over and over again to get in with someone. It sounds like she just kept being told they weren't accepting new patients at this time, or there was a 3-month wait and she didn't want to wait that long, or sometimes even longer. And she finally just gave Planned Parenthood a call and they got her in the same day. So, she was like, it's unfathomable that they're talking about taking this away. And she was not a Medicaid patient. She was just someone who needed care. And the other person was on Medicaid, but not for very much longer. She, I guess, was about to be unqualified now because of her income. But she had a few days left of eligibility, and so she got her IUD replaced a little bit early. And she was someone who'd actually been to Planned Parenthood before for abortion care when she was younger, and even younger than that when she needed just birth control. And so this has always been a place that people can go who maybe need a little bit more anonymity, or maybe need just, some place to go that's not their primary care provider to get those basic kind of services. And the woman who was on Medicaid was just very emotional about it and very passionate that this isn't like we're going backwards. This feels strange that we're taking these things away from people when they are desperately important.
And on the show a lot, we really focus in on the Treasure Valley, on Boise specifically, but I want us to look at rural communities too, because that's part of this conversation. I mean, so many of our OBGYNs have left more rural settings, and those patients don't suddenly not need care just because there's not OBGYNs in that area. So how are these Medicaid cuts going to impact rural Idahoans and rural medical providers where they're already experiencing severe shortages of doctors?
Yeah, I actually have another story about a patient who was up in Sandpoint. They were kind of one of the first L&D, labor and delivery units, to close after Dobbs, and that left that area without any delivery services. So now people have to drive further to Coeur d'Alene to actually deliver their babies and get a lot of prenatal care. But this woman was 17 at the time, and it was a few years ago. She had an IUD, which is an intrauterine birth control device that ended up coiled around her cervix. And she tried to get an ultrasound up in Sandpoint, and nothing was available that she could afford because she was homeless and she had been kicked out by her mom. And you can't qualify for Medicaid, or you can't enroll in Medicaid without parental involvement unless you're emancipated, and she was not. So she just didn't really have any options. And she said the only people who could help her were Planned Parenthood in Spokane. And that's a 1.5-hour drive maybe from Sandpoint. So she was lucky to have the means to do that with a friend, and ended up getting care there for basically nothing. She paid $20 for the whole thing because that's what she could afford. And, if we don't have that anymore, that ends up in the emergency room, most likely, once it becomes a serious problem. For her, it was just debilitating pain, but it would have become possibly infected or, things along those lines. And so that will end up overloading our emergency rooms, or people will end up just traveling way further, or stay overnight somewhere because they just don't have anything in their communities. Or the most likely scenario that I've talked about with a lot of people is they just don't get care, and then their exams go by the wayside and things aren't caught in time.
Yeah. And I've talked about that on the show. I worked in the ER for several years. And again, if you don't have access to care, you don't suddenly stop needing care. You just go to the ER, and then the community pays for that. We pay for that in our taxes. It's not like the cost of that goes away. The hospital's not going to absorb it. We will pay for it. You will have longer wait times. We're a community. When resources go away in a community, you will feel the impact at some point.
Yes.
You also wrote about how federally qualified health centers are being pitched as an alternative to Planned Parenthood if people lose access to care. Is that a realistic expectation?
It's really not in a lot of ways. Those health centers take on a lot of different types of patients, and they are usually funded by public dollars. And so a lot of them are short-staffed, and a lot of them are only equipped to do basic things. And a lot of them are in those rural places, and so they don't have as many tests, or they're not set up to do that. They're not set up to do women's care specifically sometimes, or it's a very limited subset. I wrote about how in Texas, when they cut their family funding program, they tried to set up a new state program, but it's not very well funded. And when you go to look for providers, if you want one that will do breast, cervical cancer screenings and family planning, there are 6 providers who do all of those in the Houston area. And that's an area of 5 million people almost. And so it doesn't work out that way when you try to put all these people on those health centers. And a lot of them are also struggling because of their own funding cuts. So we're cutting off piece by piece these options that we've had, and you can't fall back on those if you're also starving them out.
So what risks are our community facing if patients are forced to delay or skip preventative care like pap smears, breast exams, STI screenings because Planned Parenthood has closed or had to scale back care, and these federally qualified health centers aren't able to absorb them, and our system is already overloaded?
So in terms of cervical exams, we actually have a fairly low cervical cancer rate compared to the rest of the nation, but that could increase if we stop having as many screenings for that. And that's one of the best ways to catch cervical cancer before it becomes a true problem for somebody is to have those screenings. And even before that, you can be tested for HPV just to see if you've got one of the high-risk strains that could lead to cancer. So in that sense, we will potentially be seeing a lot higher rates of people with more advanced cervical cancer because they haven't caught it in time. And when it comes to STIs, those are already on the rise, even in Idaho, but especially in the rest of the country. And a lot of these things don't have symptoms that you would necessarily connect to sexually transmitted infections. So by the time you catch them, you could already have one of those really bad outcomes. So again, I think a lot of those people will end up with more serious complications that will end up costing a lot more money and potentially having a lot more negative health outcomes.
Now, Oregon has pledged to protect reproductive health care with state-level funding and lawsuits. Kelsey, do you think that will be enough to meet the demand of care that Idahoans will need with the federal Medicaid cuts and the state Medicaid shortfall?
I think there will be enough funding for the next year. I think there's enough attention on it right now that lawmakers have seen this as an issue and they are committed to doing something in the next legislative session. I know that there's a work group right now in Oregon dedicated to trying to find ways to pay for this and ways to make abortion access available. So I think with that focus on it, there will be enough for the next year. But it becomes a question of the next year and the next year. And as these things start piling up, what's got to give? And that I think you saw that in Washington, where they had a deficit that they were running, and they ended up cutting the abortion access fund by several $1 million. And that ended up being a very serious problem for a lot of the other clinics around the state. And it was a mistake that they regretted, but these are the things that they'll be discussing down the road. And this is why long term, it's not necessarily sustainable for a state to be stepping in and paying for all of this when the problem just will keep ballooning.
Well, and it's really interesting. We live in this red state that always talks about limited government, small government, low taxes. And then we're like a red state welfare queen, hoping our neighboring blue states will pick up the slack for us. And how realistic is that long term that we're depending on Oregon for access to care for Idahoans? So Kelsey, what's next? I mean, it looks kind of bleak. Is there, what can we expect?
Well, we did have an injunction before mid-September, I think it was. We had an injunction that was protecting Medicaid clinics nationwide almost from these cuts. But then that was thrown out by the appeals court without much explanation as to why they did that. So the injunction is not protecting anymore. And some clinics, I think Arizona just stopped allowing Medicaid patients. And there's several other places around the country that are doing that. Wisconsin just stopped providing abortion care. So I wish that I had some kind of silver lining, but at the moment, everything is just kind of a tinderbox for reproductive health care. I think for these states that do have supportive governments, there is a push to keep that support there. But we definitely don't have any kind of indication that Idaho will do that or that they won't continue to cut away at the Medicaid funds.
Well, Kelsey, thank you so much. This is a really heavy topic. It has a lot of moving parts. So I really appreciate you taking the time to sit down with me and break it down and explain what's happening and what people can expect.
Yeah, thank you. This is a really important topic to make sure people know about. So I appreciate you doing it.
That's all for today here on CityCast Boise. If you enjoyed the episode, that's a great reason to become a CityCast Boise neighbor, just like our newest neighbor, Margarita L. Thanks for joining the neighborhood. You can become a member too and get great perks like ad-free listening at membership.citycast.fm. We'll be back tomorrow morning to look at a controversial Garden City development. Catch you then.